Welcome back, everyone. It's November 19th, 2020. Our faculty guests were just talking about the state of the pandemic. And as you know, today we're going to be talking about the arts and the implications for the arts, the impact of the arts, and the legacies of the pandemic as we think forward about the arts. But it is a difficult, even dire moment in the course of the pandemic. I'm sure all of you saw that over the last day, over 250,000 Americans have now died. And that's just one element of the global pandemic. We were talking about the hard stories that are current in the pandemic. And of course, the fact that right now, there is no clear national response to the pandemic going on and no clear strategy for the transition to new leadership in January. And one thing that I think we've learned about pandemics is that they take place in real time. They don't pause over a transition period. And any delay in strategies and commitments and policies to address them creates more deaths, more infections, and continues to cripple our economy and, to some degree, our great cultural institutions. And we'll be taking that issue up today. I have to say this has been a very important class as we plan for the course. And Ingrid and I were totally committed to bringing people who are thinking critically about the arts and the pandemic and have had such important roles in the arts to the course. And as I was thinking about this morning's class, it occurred to me, this is really quite unusual. We've heard from great basic scientists, immunologists and virologists, fantastic clinicians and people who are at the front lines of patient care. But our own conviction is that you can't examine a pandemic without looking closely at culture, arts, artistic production, their impact on creativity. And in my own work, which centered for a long time on aspects of the AIDS epidemic, one can't really study the AIDS epidemic without evaluating its art, in terms of studio art and museums, in terms of performance, in terms of film and photography. So having had the opportunity to learn about AIDS through its art, we think it's crucial that we take up the questions that we will today. So let me turn it over to Ingrid to introduce our very distinguished guest faculty for today.
Thank you so much, Alan, and thank you to our tremendous speakers. As Alan mentioned, I think we conceptualized this particularly towards the end of the course because obviously we didn't know what was going to be unfolding this fall, and we were eager to hear from our speakers today to provide us with a perspective over the last kind of 8 to 9 months that they've had to face. And we really have some of the most esteemed leaders here at Harvard in the world of the arts, and we couldn't be more grateful. And we're eager to really engage in this discussion, particularly, as Alan alluded to, how art and culture has evolved alongside this pandemic and how critical this is for ourselves as humans, as we all move forward. And I think, as you all know, I'm an infectious diseases physician, so my brain has been entirely in that space. But this is critical piece of this course is how we think about ourselves holistically and who we are and how we define our humanity. And so I think our speakers today really embody that through their work. And we're thrilled to have, we'll have 4 speakers today. So let me introduce them. I'm going to start with Professor Karthik Pandyam. He's an assistant professor here at Harvard of Art, Film, and Visual Arts in the Department of Art, Film, and Visual Arts. And his work really spans from moving image and sculpture to performance And he is really an artist who works across disciplines to, as has been described, unsettle the ground of history. And I love that description of his work. He's had solo exhibitions at multiple leading institutions around the world, including the Whitney, the Midway Contemporary Art in Minneapolis, and many other places globally. And we're thrilled to have him here and speak to us today, particularly as an artist who embodies a lot of this work through his art, and the impact that this moment is really having across artistic communities. So we'll be eager to hear from him. Our second speaker today is Professor Diane Paulus. She is the Terry and Bradley Bloom Artistic Director of the American Repertory Theater here at Harvard, and she's also a professor of practice in the Department of Theater in English, and is obviously a luminary in the field. We're so lucky to have her here at Harvard. She's a Tony Award winner. And many of us have enjoyed the tremendous work that has come out of the ART that's gone on to Broadway in many different capacities. I've had the great pleasure of seeing many of her incredible pieces of work here. And I think Professor Paulus obviously brings a very unique lens to the table for us today, particularly around how this pandemic has really impacted the live theater and live performance. That's, again, such a critical aspect of what defines us. And where are we now in this moment together as we explore this? So we're eager to hear from her. She was a leader really early on, working with other people to conceptualize a pathway forward. So we'll be eager to have that conversation with her today. Our third speaker is Professor Sarah Lewis. She is a professor in the History of Art and Architecture Department and the Department of African and American Studies. You can see we have a video of her here. She'll be joining us shortly. She has wide-ranging articles on race, contemporary art, and culture, and they've been published widely in the New Yorker, New York Times, and many other areas. And she's really a leader in thinking critically about the arts and the role that, again, we're thinking about conceptually in this class is what role does the art and the production of art play in revealing important aspects of this pandemic and this bigger political moment, and particularly the experience that we're having right now. And so we're going to be eager to hear from her when she joins us. And then our last speaker is Professor Martha Tedeschi. Professor Tedeschi, who assumed the leadership and the directorship of all of the Harvard Art Museums in July of 2016. She's a specialist in 19th century British and American art, and has particularly written in depth about many great American artists, but she is really the steward of all of the wonderful art that we get to experience here across Harvard, across all of the tremendous museums. And as I was expressing to Professor Tedeschi, our son is growing up here in the city of Cambridge, gets to partake in some of the many joys of the variety of incredible art that we have available to us in this community. We're so lucky. And we're particularly eager to hear from her as someone who has directed all of these art museums, how this COVID pandemic moment has really been influencing our ability to experience and view these masterpieces. So 4 tremendous leaders, and we are eager to hear from them all. We will start today with Professor Pandyam.
Thank you. I want to begin by expressing my gratitude for the Black, Indigenous, feminist, trans, queer activists, rioters, and care workers who are leading the resistance against white supremacy, settler colonialism, and racial capitalism, and are also leading us in the reimagination of old and new relations that will perhaps get us through this time. I teach art at Harvard, but I also live in a town called Harvard, Massachusetts, 25 miles west of Cambridge. And it's the unceded territory of the Nipmuc, or freshwater people. Taking responsibility for these 3 acres of land last year has led me to center care in my life and work in ways that have nourished and challenged me as an artist. First and foremost, I want to acknowledge the women in my life who have taught me what care is, what it feels like, especially my mother, Lolita, and my partner, Paige. Their practices are radical and seen. Last summer, I'm just going to go into a keynote here. Last summer, a rabbit gave birth to a litter of bunnies in the flower bed just outside our door. I did my best to prevent our dog, Tula, from discovering them, but found her one day, having killed all but one of them. I panicked and took the only surviving rabbit to a wild animal clinic 25 miles away, but it too perished. I buried the rest in our yard. 3 weeks ago, Paige and I buried our beloved Tula. She died at the age of 8. 8 years that she gave us and we gave her in a relationship of reciprocal care. It hurts. I was up all that night, making her a casket in the studio, but the rocks in the site we chose wouldn't make space for it. So we buried Tula on a bed of flame red fallen leaves, wrapped in silk from our wedding, sprinkled with flower petals, nestled with the one toy she's had since she was a puppy that she hasn't destroyed, her baby, surrounded by her favorite treats, an avocado right by her perfect nose. I still feel broken open, heartbroken, vulnerable, especially in this space today where I'm supposed to present as professional, expert, and confident. I don't feel this way often, but I have a lot this year of breaking open. And I want to stay in that space of discomfort. And I want you to invite you too into it. And especially to invite those of us that are most privileged to stay in it and to redistribute the burden of pain in our society. This has been a year without childcare. This has been a year of me being in childcare. This has been a year of great destruction, and it's been a year of building and rebuilding, like this garden that we put into our property. It's also been a year of injury. I tore 3 ligaments in my knee in January before the pandemic, so it's been a time of rest, of recuperation, but also a time of study, of opening doors, of building gates and opening them. Most of what I've been studying are Black studies and Native studies and how they propose ways and socialities that are much older than some of the problems that we're experiencing right now and how we might pass through them. I've also been studying the garden and thinking about adjacency. What types of things, when planted next to each other, cause each other to thrive, and what kinds of things want to be far apart? Ways that we might reorganize our society coming out of this time that might actually reorder some of the imbalances of power, equity, access to resources. So the garden flourished this summer, all through this difficulty, but I felt like I was equally in touch with the compost. All that we need to throw away, all that we need to overturn, to really get your hands in the dirt and to understand, let's say, like what we need to turn over in order to get creation to come out of destruction. In this time of study, I've also been really trying to follow the lead of those particularly that are leading the way in abolition. And so I'm going to end my short presentation today by reading to you a short quote from Ruth Wilson Gilmore. Abolition is not absence, it is presence. What the world will become already exists in fragments and pieces, experiments and possibilities. Thank you.
Thank you so much for that. That was just tremendous and beautiful. And I can't think of a better way to embody this moment through those images and your words that go alongside of them. I think the garden as an analogy for this is so poignant and powerful. And so I think in many ways, that's a gift to all of us. Thank you for sharing those intimate moments from your life. They have a profound effect on all of us. And I can speak as a provider on the front line. Planting those gardens in your mind is about as close as we can get sometimes to the garden, but it's a beautiful and important analogy. So thank you for that. Our next speaker today is Professor Paulus. Thank you so much.
Thank you, Ingrid and Alan. Thanks so much for making space for this conversation today. And thank you, Karthik. That was deeply moving and inspiring. You know, the theater, which is my area of work, has been disrupted so deeply to its core because as an art form, we really thrive on collective presence. It's the transmission in real time and space amongst a group of people, and the ritual of coming together that is defining to our art form in particular. So you can imagine how traumatic this has been for our artists, for all the folks that work behind the scenes to make theater happen, in terms of not being able to practice what we normally do as our very core activity. So I think there are a few takeaways for us coming into the, what is it now, 9th month of enduring the pandemic. I think in the beginning, we were riding the roller coaster of endless scenario planning of when will this end? When can we be back? When can we reopen? And now I think we have come to terms with the fact that it will be well over a year of a complete stop to our practice as an industry before we can even think about coming back. So early on, as Ingrid mentioned, we made a pivot to a partnership with the Chan School for Public Health. And I was thinking about this very much about what it means to be a theater affiliated with Harvard University. That's driven a lot of our work at the ART, thinking about the research that we have access to and the thinkers we have at the university, and how all that, I often talk about it as a garden, actually. The garden of activity at Harvard can be a catalyst for artistic activity. So not just incredible experts in fields able to comment on the plays we do, but actually how can they catalyze work? And we had started talking with the School of Public Health about our new building. And some of you may or may not be aware that we have a new building project ahead of us in the coming years, a new home for the ART, a new center for research and performance at Harvard in Alston. And I was speaking with Professor Howard Koh, who's on the faculty at the Chan School, about public health and how a cultural institution could perhaps be a beacon for public health. You know, not necessarily intuitive, how a cultural center could animate and lift public health as it's one of its top initiatives, but this was on my mind well before the pandemic. And Professor Koh had said, you must meet Joe Allen, Dr. Joseph Allen, who runs the Healthy Building Program at the Chan School. At the time, I had no idea what a healthy building was. I never knew there was such a thing. But we got to be colleagues, Joe and I, and he was attending some design charrettes around the concept for our new building. Flash forward to the pandemic, and our costume shop had started to pivot to make masks instead of costumes. And I reached out to Joe to ask him about how we should be making these masks, how to be responsible, and make sure we were following the leading sort of health protocols of how to construct the best mask. And it led to a discussion of a roadmap, and should there be a roadmap for how theaters could reopen. I'm sorry if you hear that drilling. There's some construction going on outside my building. I hope it's not too distracting. So we created a roadmap to recovering resilience for the theater, which is on our website. If anybody's interested, you go to the AmericanRepertoryTheater.org, and it's featured on our website. And the thought there was, how could we as a theater, with the privilege of being connected to a school of public health at a major university like Harvard, what could we do in thought partnership that could be of service to the field? So the roadmap exists as a framework for thinking. It offers guiding principles. It is actually less of a checkbook, kind of like a safety handbook. And it's more about how we think about the pandemic, how we think about reopening, how we need to build in a multi-layered sort of risk mitigation thought process around how we reopen, and also how we need to stay agile and dynamic and flexible, and what is our relationship to the developing science. So that has been a huge part of what we've done over the last 8 months. Educating our staff has also been a big part of this, like not just being confused by all the messages we get and we get bombarded with in media, but how can we be in relation to the science in a way that helps to guide us? How do we stay current with developing science? And then lastly, how do we communicate about it? And I think that's a role, Alan, that you mentioned about the arts. How are we communicating? That's what we do as artists, as theater makers. We're committed to communication, and communication through narrative, and communication in partnership with an audience, right? The theater doesn't actually happen without an audience. That's the incredible thing. It only happens in the space between the performers and the audience. So the audience is critical. And I think the audience is going to be critical in how we come out of the pandemic, how we think about reopening. And that's really led to some new priorities. And I'm just going to close by saying, while this has been a disruption and been a traumatic experience on so many levels, we've tried to use this disruption to say we're not going back to business as usual. We can't. And what is the opportunity here? What can we learn? What is the learning? And I do want to lift the kind of colliding pandemics. I think that's what Darren Walker said the other day at the Ford Foundation. We're in a phase of colliding pandemics, and the reckoning with racial inequity in our country and racial injustice is a public health crisis. So as we think about public health, how are we centering anti-racism institutionally? There's been a call to cultural institutions across the country to reckon with predominantly white-led structure and dynamics and policy. So we have redone our values at the ART. Centering anti-racism is one of now our core values. We are in a long-term process of rethinking our policy, our culture, our priorities at the institution, while we're not making theater, which I think if we were racing every day to put a show on at 8 o'clock, we would have excuses not to deal with this. So trying to embrace this moment, pivot, being creatively agile, and taking in the needs for our society for true healing. And lastly, I'll just say, we might be able to talk about it more later, what are we going to learn about access in this moment? How can we think about technology and digital reach and audience in a way that is not just a stopgap during the pandemic, but a way that will actually be a whole new model for the distribution of theater, not to replace live theater. I think live theater will never go away. But how will we learn from this moment and innovate and develop a new hybrid model of art distribution that actually can increase access and increase the audience that we reach in new and powerful ways? So much to talk about, but I'll stop there.
Thank you so much, Professor Paulus, for those incredibly poignant words. You know, I think a lot of the conversations we've had over this course have been about using this moment to think about innovation. And clearly you had already been thinking about these innovative partnerships, but obviously in this moment it's accelerated those conversations. And such a critical intersection. I think it's something we all took for granted, that there would be a space that could be held for almost a conversation between performers and the audience and this deeply human connection. And now how do we conceptualize this new pathway forward? And obviously you're leading in this moment as we think about this together. But I think in a way, as we've discussed throughout this course, you know, as each of these moments, there's been kind of a rupturing, or as Alan always likes to say, the illumination of what was already there, the inequities that were there. There's also a moment to lean into that and think about new ways to bring, in this case, the arts to a much wider audience. And so I think that's a really important piece of this. So thank you for that. And we will pass our baton now on to Professor Tedeschi, who is very much in this space and thinking about all of these issues. So thank you.
So it's, first of all, I want to thank you for including me in this class. It's such an important topic, and it's one that, you know, has occupied, I think, for all of us, the major part of our thinking for the last 10 months. And much of what I have to say really echoes what Diane has been talking about. I'll try not to make the very same points. But I think one of the things that, you know, museums and cultural institutions with collections are facing is really how to think about their collections and their intersection with audience in a time when our doors are closed, and when audiences, in fact, don't want to gather in public places at the moment anyway. So this colliding pandemic, to quote Darren Walker's very apt naming of the crisis we're going through, has shaken cultural institutions, and I'm really talking today about museums, to the marrow, and has forced us to rethink our priorities, our business and staffing models, the needs of our audiences, and in fact, the needs of our workers, our employees. Some museums will actually not survive this crisis. One of the silver linings of this crisis is that those in our field are very much in touch with each other, and there's a lot of peer mentoring going on. And it's been devastating to work with colleagues who, you know, see that their institutions probably will not remain viable. So that has been, you know, both an upside, the closeness of the field, and the way I think going forward we will support each other much more, but also understanding that this is a moment that for some is a kind of death knell. Those institutions that do survive, and I hope that will be most museums, will have done the very difficult work, will have to do the very difficult work of reassessing everything from the ground up. In the long run, this is likely to be a very good thing for the field. In fact, I think we already see that it is. What's unpredictable is how our audiences will respond, how long this period will continue, when our audiences will be ready for the new normal that we are getting ready to offer them, how they will want to look at art, and what place museum experiences will have in the priorities in their own lives. So those are all things that, you know, we're all trying to suss out, but which, you know, remain somewhat a question at this moment. So the Harvard Art Museums closed on March 12th, and we made an effort and were successful in announcing that closure with all the other major art museums in Boston and with the other Harvard museums. And that was very intentional because we felt it would be easy to confuse audiences about what was safe and what wasn't. It wasn't necessarily as clear-cut a decision as one now might think, because the pandemic was at early stages, and there were certainly some voices, including here on campus, that were saying, well, museums are a place of solace in a crisis. You should stay open. You can be a place where people go to reflect and find inspiration. And unfortunately, we're also public gathering spaces. And so very quickly, all the museums realized that we would be putting off the inevitable if we didn't make this decision. So we did it all at once. And, within 24 hours, our staff was all working at home. Events were canceled. The building was secure. Lights were turned off across the museums. And everybody went home, except for, of course, essential staff. And that is, as I mentioned, one of the critical things about museums is that our budgets are largely taken up with the care of collections. And we have to do that whether we're open to the public or not. And that means keeping a climate controlled building, having facilities, people that check constantly for leaks or other kinds of climate problems, security that is there, watching the alarms and doing walkthroughs periodically throughout the day and night. So we did have to leave an essential staff on site. And then immediately we knew within the first week we were going to have to pivot to remote. And, this doesn't sound like a surprise now because all of us have had to do that in one way or the other. But we immediately had to get organized about how do you keep a staff of 210 people working productively. Luckily, we'd had some inkling about this and we'd been practicing. Everyone was doing their meetings on Zoom even before we evacuated. So we could get up and running within that first week, but it was, a much heavier lift to go from a museum that was not doing very much virtually other than, having a robust website with the collections on it, to a museum where, every way that we would communicate would be digital. And so we spent a lot of time thinking about what content we already had in hand that could be quickly repurposed, and then sending out a call to everyone in the whole museum to generate more content and come up with ideas that would still paint a picture of what a museum does, how we can continue to engage and offer the collections in meaningful ways to an even expanded audience. And that, again, I'll occasionally point to a silver lining. What we quickly found here is that this immediately addressed an equity issue, that suddenly everyone in the museum had a voice of what we would present to our public. And very interesting ideas came out of this, including now a kind of survey of the different jobs in museums and what those professionals do, including behind the scenes. So, opening up to a younger audience, mostly of high school students, the whole range of professions. And that allowed people from across the museum to really talk about their areas of expertise and share the parts of the collection that they care for. Now that we're facing we know that we're facing a much longer period of remote work. We are really pouring ourselves into the issues of communications, how we communicate with donors, with philanthropists, foundations, all of these ways of communicating have shifted. We're not as events-based as we were. Being in person used to be the best way to raise money. Now it's not really an option. And of course, although the money part sounds less important, it actually is extremely important in making sure that we survive this crisis and that we can go back to offering the robust experience that we're known for. So we are putting a lot of thought into how to become sustainable. Some of that is to strip away less important programs, things that we thought were nice to haves, and really getting down to the great work of the museum in this moment, which certainly involves equity and anti-racism. It is involving rethinking the collection to address the changing needs that we see in our audiences. It also is trying to figure out what we will be like as a hybrid organization, where we will continue to have a virtual presence that's very strong. It's been revealing to see how much bigger an audience, but also how much more diverse an audience, including a global audience, we garner with virtual programs. And it's been reassuring, although museums always talk about the aura of the original object, and certainly we are devoted to that idea. It's been reassuring to see that through our programs, we can offer an intimacy of experience that in the past we could only have offered to 15 people in one of our study rooms, that we can do an intimate experience for 400 people from all over the world. And we also see, we're learning about the obstacles that keep people away, physical barriers, transportation, accessibility issues. We're understanding better what some of the hurdles were. So I'll leave it there and look forward to answering questions after we hear from Sarah. Sorry about the slides.
No problem. Thank you so much, Professor Tedeschi. I think, it's hard to even conceptualize what a winter will be like here in Cambridge without those beautiful museums. It's certainly a solace, as you said, for so many of us, particularly in the darker days of winter in New England. They offer such a breath of fresh air and light and meaning and joy to so many of us. And I think the point that you raised about the idea of this collision between what we had assumed was truly solace and still is, and these clear public health challenges that we face during this time is really sits at the core of, again, who we are and how we define ourselves. And I think from what you've discussed and what many others who have come through our course have said, also this exciting opportunity to really think about equity, to be thinking about the collections, to be reimagining how this can be open to so many more people in a very different way. And so I think there's obviously a lot of potential in that moment. So thank you so much for sharing that. And we will turn now to our last speaker here today is Professor Lewis. Thank you so much for joining us.
Thank you so much for having me, Ingrid and Alan. It's really a pleasure to be part of this Gen Ed course. It's a joy always to be alongside my colleagues here, and Diane, Martha, and Karthik. It's wonderful to see you after nearly actually over a year in which so much has changed. I want to speak briefly today about, how this moment has reanimated our understanding of what the arts can do to shift our notion of who counts and who belongs in society. I say that at the start, but I should also confess that when I was invited to speak, as Ingrid and Alan know, I initially declined, not out of a lack of desire to speak about this topic, but because the article that I wrote about images in the time of COVID was born of such grief that I didn't know that I might be able to actually do this. I'm happy to be here today, having gone through a different stage of the grief, which brings me to a heightened sense of urgency about the topic. And so let me begin by sharing my screen. Can you see that all right? Okay, great. My experience of the pandemic began in earnest when my extraordinary friend and mentor and colleague Maurice Berger died due to complications of COVID-19. It was March, I was in New York City, and I was also healing from, and I'm sorry about your injury, Karthik, an injury that had me out on medical leave at Harvard. I was in a taxi which collided with another taxi, and I sustained a pretty severe concussion and had been forced actually off of the computer entirely for approximately 3 months. And it made more acute my understanding of the difficulties that many of us have in honoring health and honoring life above work, above our deadlines, above everything else. Maurice is someone I was so looking forward to having more time with, especially given the moment we're in right now. As the New York Times obits subtitle states, he was indispensable for understanding some of the most difficult issues in our field regarding race and equity. And what you're seeing in terms of the photograph is Maurice in the exhibition that I asked him to organize about the work of Gordon Parks for the Vision and Justice Conference at Harvard. Every day that passed, I would think about Maurice as I would hear in New York City the wail of these ambulances every 10 minutes or so near to my apartment on the Upper West Side. And I would think about how so much of what was missing in that moment was what Maurice was known for, having researched and written about, namely the function of images and visualization for getting us to understand what truly nothing else can. At the time in March, if you think back to what we were mainly seeing, it was largely statistics-based evidence about the spread and the scale of the pandemic. And despite the best efforts of our data visualization experts, the extraordinary graphs that we saw, what I knew as a historian, what Maurice had written about and known as well, was that nothing can replicate, historically speaking, the power and force and detonation of an image, a cultural event, to state what we now know the mind itself can't fully comprehend. And that is the massive scale of devastation that we're experiencing now. It's a paradox, effectively, that the larger the scale, right, of a number, the more difficult it is for the mind to actually comprehend it. So I thought about what was lost from our conversation and not having images of this devastation. And I don't know that I would have written about it without coping with the grief that I was enduring and really feeling it at that moment, because after Maurice's passing, many of my other friends did pass as well, that there was nothing to lose, that everything was at stake. I saw, for example, this image of the public cemetery in New York City, Hart Island, and at the time thought of it as an example of how our sense of the severity of the pandemic would have shifted if it was more well known. And this was the image that was included in the New York Times piece, but I should state that George Steinmetz attempted to take a similar photograph and had his drone camera intercepted by the police to give you a sense of the seizure around this and the lack of visibility of this site. I thought about all the conversations Maurice and I would have had about how images and other moments of time have shifted conversations when scale actually prevented public discourse. I would have thought and would have imagined that we would speak about Frederick Douglass and his understanding, having become the most photographed American man in the 19th century, of the importance of what would have seemed like a trifle in the state of that nation's severing conflict, namely photographs, and their force and power in the imagination, so much so that he named his speech Pictures in Progress about this idea by including this term thought pictures, right? He wasn't just interested in the mastery of an image or the work of one photographer or another, but the phenomenon, the broader phenomenon of how it is that we can imagine ourselves anew after the critical force of an image greeting us. And Sojourner Truth thought of this as well. I know we would have considered, as Maurice has written about, FSA photography and the way in which, for example, Dorothea Lange's Migrant Mother galvanized the public to actually understand the collective conditions of the Great Depression by focusing on here one mother with her children in a pea picking camp, and the results and spread and distribution of this image did result in relief efforts happening in Nipimo, California. We might have thought of it in the context of the civil rights movement and consider the work of Gordon Parks himself. On the right, you're seeing the Brown versus Board of Education sort of related image of the Kenneth Clark doll test taking place and showing that young boy choosing that white doll with his hand, though with his eyes still engaging with the black doll on the left. On the left of your screen, you're seeing another image by Dorothea Lange documenting Japanese internment and the way in which people were rendered objects, tagged for removal and sent to internment camps. A fact, a phenomenon that couldn't have been explained, understood, or made more tragic any other way. What the pandemic did in the end for me, and thinking about here the term collision, though I don't love it as much because of having experienced one myself, of pandemics, is forced me to, in my own work and scholarship, think about what we actually are now forced to address, which is the ground of all of this. I've been in the lab since, I guess now, May, finishing up another book about which an article has just come out that's focusing on what I'm considering as groundwork projects. What I've noticed over the course of the pandemic are sort of the phenomenon of the rollout of projects that interrogate this figure-ground relationship. What is the ground on which we all collectively stand? Here's an image of the late Congressman John Lewis looking out towards the White House on a street that has been named for the Black Lives Matter movement, celebrating the actual naming of it instantiated on the actual ground as one example. But by this, I also mean works by Hank Willis Thomas. Here, I'm offering you one example surrounding the EJI Memorial, in which we see these outstretched hands and this kind of universal gesture and sign of surrender, and with bodies that are sunken into the grounds as a way to conceptually and figuratively consider the systemic conditions that limit freedom, that limit mobility. I've been thinking about this in the context of Amy Sherald's work. If you surrender to the air, you can ride it, in which you're seeing the suspended figure precariously placed, seeming to inhabit at once a place of respite and kind of reward, the sky, but also a place of danger. How has he arrived on that beam, and what is actually supporting the ground beneath him? Kehinde Wiley has long considered this figure-ground relationship, but with renewed energy at the time of the pandemic, just before he had debuted Rumors of War, a piece that is born of the composite face of 6 African-American men who have died in states with stand your ground laws. I mention all of this, and I can conclude with this other Hank Willis Thomas piece, because what the pandemic has allowed us to also interrogate are the conditions that have been born of the hypervisibility of racial injustices on American ground. And these artists that I've listed, and there are many others, create a set of aesthetic strategies through which the literal and figurative meaning of ground can be destabilized productively. We use that term, stand your ground law, without fully interrogating it in either the Heideggerian sense, in terms of reason. What are the grounds for this, we often say, right, in the context of law. But to think about Karthik's idea of the garden, I want to think quite literally about how artists are physically interrogating the ground itself. And it's a project that, of course, is asking the discipline to make more methodological room for the engagement with the social world that these artists have always had, but now more acutely. And it's certainly my conscious attempt to do what felt premature when Maurice Berger died, but I now see is my charge, and that is to pick up the baton from him. So thank you very much.
Professor Lewis, thank you so much. And I'm so grateful to you for your courage and resilience in being here today. And so it really means a lot to us. I'm sure it means a lot to our students who are in this virtual space. I just have to say, I've found today's presentations just deeply moving, far beyond even my high expectations for this session. And I have, in my work on disease, become convinced that one can't understand disease and suffering and epidemics without understanding the arts. But all 4 of you have made such a determined and impassioned case for that that in a way, I'm at a loss for words. I'm just inspired by all of these discussions today. I guess I would say, as I was reflecting and listening, I think together, all of you have captured a very powerful sense of pain and loss. It's obviously losses of people who have been so important to us or that we've loved, but loss of the ability to make art, to bring people into the world of arts. And this is a very sad and sobering time. But what I also took from all of your presentations is the significance of resistance and the potential for resilience. And the reason I would say I'm inspired is because I know that the arts will be resilient and they will be responsive and they will look different than they looked before the pandemic. But there's been this crisis of the disruption. And today's talks, more than anything, honestly, I've heard in the course, I'm very hopeful about vaccines, but there will be arts. And I'm very interested and curious and eager to see what they look like and what they represent. And one of the things we've been talking about in the course has been this intersection of what's come to be called racial reckoning, but really reflects centuries of oppression and dispossession. And today, I think I better understand in a way that I've struggled with the relationship of the Black Lives Matter movement to the COVID pandemic. And that's a complicated set of relationships and meanings and activities. But today's session really, I think in a very powerful and human way, in a way that maybe only the arts can, help me understand that better. So I'm incredibly grateful to all four of you. And we have time now for students to engage with the really powerful things that you have spoken about. So let's get some students into the discussion now.